Hi, welcome back to the channel. My name is David Osuji, a psychiatric mental health nurse practitioner in the Dallas area. I received this question recently in clinic. Why do I feel different emotionally since starting Ozempic, which is also known as Semaglutide? And then we're not talking about nausea or appetite. They meant their mood, feeling less reactive, but also a little disconnected. And honestly, I hear this more and more. So I responded, but I took the time to do a little more research so that I could respond properly today. So let's talk about what might really be going on, and not just in your body, but also in your brain. You might know these medications by their brand name, Ozempic, Wegovy, but overall they are called Semaglutide, and it is a part of a class of medications originally made for type 2 diabetes. Today, people use it for weight loss, appetite control, and blood sugar regulation. But here's what most people do not realize. Semaglutide doesn't just affect your stomach. It communicates with your brain. And for some, that message changes how you feel emotionally. I've had patients tell me, I feel calmer, more clear-headed, not as emotionally all over the place. But other people might say, I feel flat, a little disconnected, even anxious for no reason. Both reactions are valid. And no, it's not all in your head. At least, not in the way people usually mean it's all in your head. There are brain-level explanations behind this. Here's the science in plain language. Semaglutide mimics a hormone your stomach naturally makes called GLP-1. That hormone doesn't just affect digestion. It also reaches tiny receptors in your brain that influence your stress response system, your motivation and reward pathways, and even levels of inflammation in the brain, which can affect your mood. Think of it like this. Semaglutide is a gut messenger whispering to your brain, hey, you're full, stop eating, relax, you don't need to chase that snack or that feeling. Depending on your baseline wiring, that message might bring calm, or it might feel like something is missing. Now, let's talk about what's happening outside your brain. Weight loss often leads to changes in your lifestyle, your habits, and even your identity. Some people feel more confident, more in control, ready to build better routines. But other people might feel out of sync with their body, less emotionally grounded, like they've lost an old coping mechanism, like that emotional eating that they were so used to doing. This emotional disorientation can sneak up on you, especially when the physical results look positive on the outside. So here's how you can check in with yourself. Ask, have I been feeling more emotionally steady or more emotionally numb? Is my anxiety improving or getting louder in the background? Are my relationships feeling more peaceful or more strained? If you're noticing gentle shifts, like feeling calmer or eating more intentionally, that's often a good sign. But if you're feeling disconnected, irritable, or emotionally blunted for days or weeks, that is definitely worth mentioning to your prescriber. There's nothing wrong with needing extra mental health support while your body adjusts to the medication and the changes. You're not broken, you're just adapting, and that's something we can work with. Semaglutide is a powerful medication. It's not just helping you lose weight, it's also rewiring your relationship with food, stress, and emotions. That's why it is so important to treat it as more than just a weight loss tool. In part 2, I'll go deeper into the risks and the mental health consequences of GLP-1 medications, especially for those who are already struggling with depression, anxiety, or disordered eating. So, if you started semaglutide and your emotional compass feels a little off, you're not alone. Follow along, and if you want care that looks at both your body and your mind, that's what we do here at Elevate Life Psychiatry. See you in the next video.